The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me, I listen to what they're saying, and I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to make the proper diagnosis and treat your illness. To maintain a clean and safe environment, my office has several ultraviolet C-wave lights to sanitize and kill bacteria and viruses. If you wait, it may be too late. To my military family, I got your 6. To my Masonic brothers, the light is bright. Now on to today's topic. Questions and answers, part 3. Last show was phenomenal. I really covered, actually the past 2 shows, No Fault Part 1 and Part 2, really discussed, so you have an understanding of what the definition of no fault and the insurances and, what to expect. So the feedback was positive. And so I received several emails through my website, with questions. And I figured, let's cover this so we can keep with the same theme. So you really get a good understanding, because this is something that's not really covered. Yeah, hypertension, diabetes, you go to your doctor for history and physical, but what happens, when you're injured in an auto accident? And so that's why I felt it was necessary to really dive into this, without using fancy terminology, so I can break it down so you can understand the concept and how my team, again, I'm going to be working with the best no-fault lawyers in the industry within our community, as we know as Bulldogs. All right, so the first question, can you explain what the difference between a disc bulge and disc herniation? Absolutely, but let's just go over what a disc is. So we have the spine, okay? And when I'm talking about the spine, let's just focus on the bones itself. So you have a bone above and a bone below, and then in between there's a disc. Okay, this little fibrous disc. It's a cushion. Think of a cushion. All right. Now, within that disc, there's a central, what we call a nucleus pulpus, which is a jelly-like substance, jelly-like material. And that gives it a little bit flexibility. Surrounding that is a fibrous tissue, okay, like fiber, and that gives it its structure. So it has form. What did I say in the past? Structure is function. Without proper structure, there is no function. And this is going to apply to disc bulges and herniations. So what is a disc? Now, I'm going to use an analogy so you get the concept, and you're kind of probably going to giggle, or maybe you're going to get hungry. So, you can have a frosted donut, right? A jelly-filled frosted donut, a nice one that comes out of the oven. It's nice, it's round, oval, it's nice and like an inch thick. That would be a healthy disc, okay? Then what is a disc bulge? Take that same image, that same donut, and kind of like squeeze it down a little bit and have the jelly ooze out. Now, to understand that the jelly does not ooze out of a disc, it just oozes out of the central, like the center part of the disc, and kind of like shifts a little bit. But I just want you to get to understand the concept. So a disc bulge would be that same donut, but with the jelly oozing a little bit. Then what is a herniation? The same thing, but this time the donut's going to be flattened and the jelly's really oozing out. And then that it's not round anymore. It's not an oval. The shape has changed, it's flattened out. That's usually the one that no one wants to buy. And then if you're so hungry, you say, well, I'll take that one. So that's what a disc herniation would be. Is when the nucleus pulpus really changes shape and squeezes out within the fibrous bands, and it changes the shape so it's not that oval shape, and then the size greatly decreases. And as we age, naturally the disc starts to dehydrate and get smaller as well. But again, structure is function. Here we have the structure. It's starting to change, and we start to lead and develop dysfunction. All right, so it doesn't support. All right. So what are signs and symptoms of a disc bulge and herniation? Well, the symptoms range from no symptoms right through paresthesia. Paresthesia, that's the pins and needles. You have the burning sensation, that pain that radiates down into your upper and lower extremities, so we call radicular pain. Or we have people, like I just mentioned, they have no pain at all. And there is a percentage of the population that has herniations and they have no symptoms at all. They live their entire life and then they have to go in for a procedure. Oh, by the way, I have a herniation. Oh, I never had any pain. I don't have any problems. Okay, so that's would be signs and symptoms. So you can also see like atrophy if this is going on for a long period of time, where you start to see atrophy where the muscles start to get smaller. Now, hypertrophy is like what a bodybuilder does. When you're working out, the muscle grows. This is the exact opposite. Why? Because we do not have enough nerve impulse going to the muscle to maintain the size of the muscle. Okay, we need a baseline of nerve impulse to maintain our muscles. What are the treatments? Treatments are, can range from conservative all the way to very aggressive. And the very aggressive would be surgical intervention. Conservative would be over-the-counter NSAIDs, weight loss, exercise program, physical therapy, and manipulation. We could also start advancing into corticosteroid injections, epidurals, facet blocks, and so forth. Again, the most aggressive would be surgical intervention, and we try to wait. That would be last, unless it's so bad that we need surgical intervention right away. But we try to start off with, at least in my approach, to start conservative, and then we advance as our treatments are failing and we have no choice to go the surgical route. The goal is to improve the quality of life. Everything's about improving quality of life. All right, so the next question was, what is spinal stenosis? Because we hear people that complain about, they're involved in an accident or something, workers' comp, some sort of injury, and they do an MRI and they say, well, we have spinal stenosis. So what's the anatomy of the spine? Okay, now we're going to talk about the bone itself. The bone has a foramen, a large hole, and that's where the spinal cord passes through, right? We have the brain, then we have the brain stem, and then the spinal cord. And the spinal cord travels through this these holes. Well, we could be born with a smaller hole, or due to an injury or a change where we have a slippage of the disc itself, and that foramen, the size can change. We can have some calcification build up, and that could change the diameter of that hole, and that could cause problems. Signs and symptoms, again, there could be no symptoms at all, or you can have symptoms where you're having pain or even weakness, and depending on the level where that spinal stenosis is. So weakness, or where the nerves innervate those organs and dermatomes in the area, and then we can see atrophy or pain, okay? Treatment, well, it can be, again, conservative, and we can be real aggressive, which would include corticosteroid injections all the way up into a surgical procedure. Again, over-the-counter NSAIDs, weight loss, exercise program, physical therapy, and manipulation. But before you do any of this, I would always say consult with your physician or your orthopedic, your PCP or orthopedics, before you do anything. All right. Again, the treatment goal to improve quality of life. It's all about improving quality of life. All right, so I have about 35 seconds left in segment one, and that's how fast this goes. I do have more questions that I would like to answer. So if you wait, it may be too late. I offer a very affordable concierge practice. Make that call. I am taking no-fault patients, so if you are involved in a motor vehicle accident, give me a call. You're going to get that quality care you really deserve. It's you and me. We work as a team, and I'm going to be working with the best no-fault attorneys in our community. So to learn more about my practice, go to drtomio.com. That's drtomio.com. Welcome back to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. Today's topic, question and answers, part 3. So let's continue. Another question from a listener, and again, I want to thank my listeners and appreciate you giving me time on air and listening and the feedback, because I do run into people in the community and say they listen to the show and they really like the show. I'm going to try to make the show interesting and educational, and that's what this is about. I'm going to make a point. Before you start any exercise program, please consult with your physician, all right? You want to make sure you're medically cleared, especially as we're getting older. And make sure you're medically cleared by your physician, then you can start a program. Again, medically cleared, start a program. If you don't have a physician, come to Dr. Tommy O. I'm going to take care of you, and I can clear you. We can start up a program, an exercise, weight reduction, or whatever you need. We'll work together as a team. All right, the next question. My son recently was involved in a sports injury and tore his ACL. The ACL is the anterior cruciate ligament. Can I explain what that is? All right, so the anterior cruciate ligament. All right, so let's go into the anatomy. Let's keep this really simple. We're going to talk about the thigh bone and the leg bone. So what's the thigh bone? From the hip down to the knee is the thigh, or the thigh bone, okay? And then from the knee down to the ankle, there's 2 bones, but just for this discussion, let's just say leg, all right? All right, so in between the thigh bone and the leg, there's cruciates, okay? And this is a ligament that crosses, right? Cruciate cross. There is an anterior and a posterior ligament. The function of the cruciate is to prevent anterior and posterior slippage of one bone on the other, okay? So when we walk, we're not throwing our leg. It's nice and tight, all right? So what are the signs? Well, there's an injury that occurs. So I just define what the anatomy is. So what type of injury can one sustain? Well, it could be something very simple as just inflammation in the tissue, okay, where we have a strain sprain, all right, where you inflame the area and you stretch it a little bit and it swells up. And then we can have a partial tear, or we can have a complete tear. Now, in order to determine which, you would first do a thorough physical exam, and then, if necessary, we would do an MRI, and that would determine the degree of injury. So what are the signs and symptoms? Signs and symptoms could be, as simple as just swelling with decreased range of motion, because you're injured the body, so it swells up. How much swelling? It all depends on how severe it is. We would have decreased range of motion. We can have pain, severe pain, and to the point where you're not able to ambulate, not able to walk on the leg. What are the treatments? Well, again, it all depends if it's if it's just it's a sprain, or it's a partial tear or a complete tear. Again, we start off conservative. Okay, conservative treatment, over-the-counter NSAIDs, some physical therapy, apply your ice, and then we start to advance with our treatment. Again, if it's real severe, then we need surgical intervention. And that's something that you would discuss with your orthopedic surgeon, because typically you'd come to a doctor like myself, or you'd go to an urgent care center, and we would diagnose and send you out for either I would send you out for an MRI, or I would refer you to an orthopedic, and then the orthopedic would order those tests and then come up with the definitive diagnosis. There are certain physical exams, on the physical exam itself, I do certain tests, and that will give me an indication of what's going on, but ultimately an MRI we would need to for a definitive diagnosis. Again, you would discuss with your orthopedic surgeon the approach, how conservative or aggressive the treatment would be. Again, that depends on the training of that surgeon. Some surgeons are conservative, and they will say, let's just do physical therapy, and then others are going to be more aggressive and say, we need surgical intervention. All right, here's another question. A family member injured their rotator cuff muscle tendons. Can I explain that? Yes. Okay. So what is the rotator cuff muscles? All right. So a lot of people think that's the shoulder. No, the shoulder's your deltoid. Your shoulder's the deltoid. We have the anterior, middle, and posterior head of the deltoid, which forms the actual shoulder. Then we have what's called rotator cuff muscles, and they are the infraspinatus, supraspinatus, subscapularis, and teres minor, not the major teres minor. And those muscles are on your back. All I want you to think of is your shoulder blade, the muscles around your shoulder blade. Two muscles are on the facing out. Okay, so you have the supraspinatus, because there's within the shoulder blade there is the spine, and above the spine would be the supraspinatus, and below would be the infraspinatus, and then underside facing inside the body would be the subscapularis. To your side, where your lat would be, or to lateral aspect of your back would be teres major and teres minor. In this case, the teres minor is part of the rotator, the muscle itself. Okay, because there's four muscles that form that muscle group. Now, we have tendons, okay? Tendons from those muscles, they insert, the origin is the muscle, and they insert onto the head of the arm muscle. Again, I'm keeping this very simple, no fancy terms, just the arm, the head of the arm, and the head of the arm inserts into the shoulder, okay, into the socket right there. And these tendons attach there. So what will happen is there's an injury now, some sort of like a high velocity injury, some sort of pulling, you're falling, you're pushing against it, and then you're injured. It could be as simple as just a sprain, or partial or complete tear. What you would do is you'd come to me, or a doctor like myself, orthopedics, and then we would do certain physical examination, and I would test for strength, okay? And if there's some strength, partial strength, or where you're able to resist, then, we're saying, okay, we do have something going on. Is it partial or just a sprain? Again, ultimately an MRI. If there's no strength at all, like you're not able to resist me and I'm pushing down, you're not able to lift your arm up and give me resistance, then there's a good chance there's a complete tear of one of those tendons. Which one? Well, there's different angles, external rotation, internal rotation, circumflexion, extension, and abduction and abduction. There we go. I got them. And depending on the situation, we'll know which of those tendons are affected. So again, ultimately, we would need an MRI. An orthopedic surgeon will work that up. And what would be the treatment? Again, depending on the severity, if it's a sprain, partial tear, or a complete tear, that will determine how aggressive we're going to be. And depending on the training of that surgeon, the surgeon might take a conservative approach or be aggressive, depending on the severity. Again, the goal is to improve the quality of life, decrease pain, increased range of motion, and quality of life. All right. So we got a little bit more than a minute left. So I just want to remind you that I am still accepting patients for my medical membership, as well as I'm now taking no-fall. So if you're involved in a car accident, give my office a call. If you need a lawyer, give my office a call and I can get you a lawyer. You're going to get that quality care you really deserve. Let me help you lead a happier and healthier life. If you wait, it may be too late. Again, no fault, very strict policy. You have 30 days to get your paperwork in. If it's after 30 days, the policy can deny claims, okay? Deny services. So you gotta get your paperwork in quick. I offer a very affordable concierge practice at the price of less than the cost of a monthly cell phone bill, which allows you access to the quality care you really deserve. With no rush to office visits, both you and I can discuss your health care needs. To learn more about my practice, go to drtomio.com. That's drtomio.com, or give me a call at 631-980-8200. That's 631-980-8200. If you have more questions, go to my website and go to Contact Dr. Tomio and just type away and hit send.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.